Here are the top 3 mistakes that students make when they are staging a periodontitis patient. The first thing is that assuming a patient with tooth loss is automatically going to be a stage 3 or a stage 4 patient. Notice here on the chart, it says tooth loss due to periodontitis. If you do not have that information, then we cannot assume that the teeth are missing due to periodontitis. The other thing I see where people go wrong is that they say if a patient is missing many teeth, meaning if you have fewer than 20 remaining pair, then you are automatically a stage 4. That is not correct because notice it says here the initial stage should be determined using clinical attachment loss. If you do not have clinical attachment loss, then you cannot have perio, meaning you cannot stage this patient. So just because they're missing a ton of teeth does not mean they are automatically a perio patient. The third thing I see students get wrong is the extent and distribution. Notice that it says localized perio means less than 30% of the teeth are involved. It doesn't matter if a patient has some areas that are 1 to 2 millimeters and some areas that are 5 millimeters or greater. It doesn't matter as long as less than 30% of the teeth have attachment loss, that would be considered localized perio. If 30% or greater of the teeth have some attachment loss, it doesn't matter the severity, that would be generalized. So the generalized and the staging are almost two separate components. The generalized or localized is saying how many teeth are affected. The stage, like stage 1, 2, 3, or 4, is saying what is the worst area.